Welcome back. So it's getting better all the time. Mental health outreach, providing information and support while encouraging hope and faith. So you can find out more about us by logging on to our website at www.igbattmho.org. And today I wanted to make sure my camera is looking a little, move over here. I wanted to take a minute to go on what I call my rant, actually. And I label this my rant about getting help. And what prompted me to do this, and by now, if you are in the United States or listening to the news, you may have heard about a gentleman by the name of Jordan Neely. Who's Jordan Neely? Jordan Neely was the young man, the gentleman who was choked to death on the subway train. He was put in a chokehold, choked to death on a subway train in New York by another rider. Okay, let me read this here. Jordan Neely, 30, died on May 1 when a Marine held him in a chokehold for several minutes after he allegedly started ranting aggressively on the F train. At the time of his death, Jordan was known to New York City police as a troubled drifter who frequently complained of mental illness, telling cops he was schizophrenic and sometimes even suicidal. Evidently, he was an entertainer. He did a lot of impressions on the plane, on the train. I'm sorry. He has an aunt, and I'm reading this from the New York Post. So he has an aunt and he has a nephew. Okay. People close to him acknowledged that he did have a years-long struggle with mental illness. According to them, they said he had it, after the death of his mother. I'm going to read it here. There. Right. Okay. So, what I want to point out from this article is I'm not going to read the whole thing. I want to make sure you know who Jordan Neely is. He was a man who was killed in New York City on the subway train after being put in a chokehold. This was a person who evidently, on that day of, he was on the train and he was behaving aggressively. So much so that someone actually, grabbed him and, tried to restrain him by using a chokehold. According to this is someone who was known by the police as a drifter, frequently complaining of mental illness. According to his family, they said he was, because he had family, that he wasn't aggressive and that he had a long history with mental illness. Okay. And then now many people are outraged, as we should be. But here's my rant with this. A couple of things. It is important that we get people with severe and persistent mental illness help. When we talk about severe and persistent mental illness are those illnesses that are so severe that they impact all aspects of an individual's life. Severe and persistent mental illness is a category that's actually defined within the federal government that defines severe, persistent mental illness, severe mental illness. And the reason why we define it as severe, sometimes people call it severe mental illness or severe and persistent mental illness. But the reason why we can define it that way is because that's what it is. It's severe, impacts all aspects of an individual's life, and it's persistent. So that's number one. So we knew that this person had a mental illness. But number two, and I'm going to maybe be all over the place with this because as different thoughts come to my mind. So we knew that this person had a mental illness. We knew, first of all, his family knew that, because he had family, according to this, that his family knew that he had a severe and persistent mental illness. Okay, he had come in contact with the police, so evidently there may have been some police records so that they knew. So the guy was on the train. He was approached, or I'm not sure how, when he approached the guy or whatever. He was on the train, behaving aggressively. You had a bystander who come on the train who may not have known his situation, may not have known who he was, didn't know his history, just knew that this guy was behaving aggressively. Okay, according to the reports, that he was behaving aggressively. So much so that this guy felt that he needed to protect himself. Why he needed to use a chokehold, I'm not really sure. A chokehold for that long, I'm not really sure. That's not my point. My point is that we always wait until there is a tragedy before we start talking about we need to do something for the people with severe and persistent mental illness. We always wait. As I said before, we can't wait until situations happen like this, because this gentleman, Mr. Neely, according to his family, he had a mental illness. Everybody knew this. So why was he not in treatment? Okay, why? Or maybe he was. Let me not say that. It didn't sound like it. But why was he not in treatment? Why was he on the train? Why was he, saying that he was hungry, saying that he needed something to eat? Why was he on the train saying this? Why are we not doing more for our brothers and sisters who are living with the symptoms of a severe and persistent mental illness? And before that, I say that I'm not talking about the government, I'm talking about all of us. Because number one, as family members and friends, what are you doing for your loved one who have a severe and persistent mental illness? See, it's easy to put the blame on the government. It's easy to put the blame on the police. But what are you doing, family members? You live with this person every day. It is your family. It is your friend. It is your loved one. What are you doing, right? That's number one. Number two, and I say this all the time, by the time the police get involved, anytime you have to call the police for a psychiatric emergency, then that is a failure. That is a treatment failure. The police should not have to deal with a psychiatric emergency because there are too many other resources. There are too many other people whose job it is to deal with it. It shouldn't be the police. The police should be the last resort. So the question is, if you have a family member, right, who is living with a severe mental illness, what are you doing? What support are you offering them? What information are you getting? You may say, well, Annette, I don't know what to do. Well, then I'm glad you asked. So one of the things that you want to do, you have a loved one who's living with a severe and persistent mental illness. Number one, you want to know, remember, we're talking about something that's persistent. So there may be times when the symptoms will be stable. Well, they'll be stable. The symptoms are stable. But then there are times when they'll fluctuate. So unfortunately, what people do, we're crisis prone. When something is a crisis, then we're all involved. We got to do something. And then when the crisis is over, then we stop. We forget about it, right? So here's the thing. You have your loved one. Your loved one, let's just say ground zero is your loved one is coming home from the hospital, or they just got home from the hospital. What you want to do then is begin to sit down with your loved one while they are on their medications, while they are just coming from the hospital, and begin to talk about a plan. Talk about what happened. Talk about what we will do the next time this happens again. You want to develop let me know, loved one, what are some of your symptoms I should be looking for that will let me know that your symptoms are getting really bad, out of control? How do you feel? What does that look like? All right, I should know what medications you're on. I should know who your doctor is. You don't have a doctor, we need to get one. These are things at ground zero you need to begin to pay attention to. You should know who your loved one's psychiatrist is. You want to know where they go, what treatment program. At least once you want to go along with them. You want to go with your loved one. So number one, you're able to sign any paperwork that you need to sign, so that way if there's an emergency or there's a crisis, you can call and can freely talk to them, right? So that's one of the things. These are some things that you want to do. These are just some tips. Number one, you want to accompany your loved one, and I'm repeating myself over again. You want to accompany your loved one to their appointment. You want to ensure that you meet the treatment team, psychiatrist, therapist, case manager. You want to ensure that your name, phone number is up to date, that's in the record. You want to ensure that your loved one has given the clinic authorization to contact you, or authorization for you to talk about their case. You want to make sure that's done. You want to pay attention to your loved one. You don't want to wait before symptoms get out of control. When we're talking about severe and mental illness, psychosis, as I said before, psychosis by its definition, it just means being out of touch with reality. You don't necessarily want to wait until your loved one is psychotic, because it doesn't happen overnight, all right? It doesn't happen just like that when we talk about severe mental illness. Now, drugs sometimes is a little different, but we're talking about severe mental illness like schizophrenia or bipolar. It doesn't happen overnight. you relapse doesn't just happen like that. You see the signs. And the goal is before it gets to that point, you want to kind of stop it before it gets to that point. How do you stop it? By having a conversation. Hey, you want to say to your loved one, hey brother, I noticed these particular symptoms. I noticed you're not sleeping well. I've noticed that you're not eating like you used to. Is everything okay? You want to begin to start to do something here. All right? Let's talk to your doctor. Maybe we need to make some adjustments. So number one, you want to do something. You want to be proactive before the situation gets to the point where you can't. Okay? So number one, you have a loved one. You know the person have a severe and persistent mental illness. My question is, what are you doing? Right? You may have to be the person that advocates for them to get into the hospital if you feel that's what they need. There is this thing about, well, we don't want people to have to be going to the hospital against their will. Would you say that if a person was bleeding to death on the street? Right? If your loved one was bleeding to death, or even if it wasn't your loved one, if you saw someone on the street with their guts hanging out and they were bleeding to death, would you just say, they don't want to go to the hospital, I'm not going to, go against their will? Or would you at least call 911, right, and say, hey, there's a guy on the street that's bleeding? Even if you didn't stop to help, many of you would at least call, I would hope. So why don't you do the same thing for our brothers and sisters who are living with a severe mental illness? At that particular moment, when a person is living with a severe and persistent mental illness and the symptoms have gotten to the point where they're psychotic, they are out of touch with reality. They need help, right? They are bleeding on the street, okay? It's just like you just can't see the blood. You just can't see what's going on. They need help. They need somebody to support them. So that's number one. Number two, if you do have to call the police as a loved one, you do have to get the police involved. But number one, before you try to get the police involved, remember the crisis team. These are things that you want to do on ground zero. Ground zero are the things that you need to do that while things are peaceful, while your loved one is stable, while they're not actively psychotic, they're taking their medications, or you're taking your medications. If you're the person that that's dealing with diagnosed with schizophrenia or bipolar or some other kind of disorder where psychosis may be one of the symptoms. So while things are peaceful, you want to develop your support plan. Who do you call in the time of trouble? What are your medications? You want to let people know, okay, these are the signs that you should look for. These are the signs that will let you know when I am headed for a relapse. If you're a family member, a loved one, you want to ask your loved one about these. What are some of the signs? What are some things that I need to look for? Or what are some things that will let me know that you're not feeling well? How do I know you're going from well to unwell? What are some of the symptoms? Some of the symptoms could be an increased sleep and an increased appetite or decreased appetite. It could be different type of thoughts. It could be pacing. It could be increased smoking. It can be increased eating. Whatever it is, it's different for different people. That's why you want to have a conversation with your loved one. You also, again, I'm repeating myself, during ground zero, is make sure you connect with the treatment plan, the treatment team. And I'm talking to loved ones now. You want to know what who the treatment team is, who the psychiatrist is, who the therapist is, who the case manager is. You want to ensure that you have you have the right, you sign paperwork to give you the right to ask questions, to answer questions, or to make reports if your loved one is not doing well. Okay, that's that. And when you see your loved one becoming unwell, they're not doing well, you want to begin to kind of utilize coping strategies that you talked about at ground zero. Because remember, ground zero, you're asking, what are some of the things that I'm looking for or I should look for that will let me know that you're not doing well or you're starting to become unwell? And when I see these things, what helps, right? So when you see your loved one starting to become unwell, that's the time you want to kind of inquire and have a conversation about coping strategies. How are we doing? Maybe we need to call the doctor? Do we need to, do you need more rest? What do you need from me? You want to have that conversation. If that's not working, that's when you want to pick up the phone, and that's why it's so important to know who your loved one's treatment team is. So you want to pick up the phone and say, hey, this is Sarah, Michael's brother, sister, mother, and this is what I'm noticing. Can we get him in? What should we do? You want to know who that treatment team is, who your loved one's treatment team is, so that you can begin to ask for help. So you can reach out, because the goal is to get them to stop the symptoms from becoming a full-blown relapse, okay? All right, so let's just say that doesn't work. You want to also have the number to the crisis team. All right, in many areas, places have them. Not every place does, okay? So not every place does. But if you do have a crisis team, you want to call the crisis team and say, hey, this is what's going on, and the crisis team will advise you. They may come out. Keep in mind that the crisis team, if it's an emergency or if it's a case of dangerousness, the crisis team, if they come out, they may come out with the police, or they may ask you to call the police, okay? So just keep that in mind, because the crisis team is not made up of, police generally. Many times, though, the crisis team and the police work together. If there's a call, the police, the crisis team know that they can call the police, but many times they may come out together, or if one shows up first, if the crisis team shows up first, they may call the police, okay? But if you do have a crisis team, try to call the crisis team first. All right, let's say you don't have a crisis team. Let's say you don't have a crisis team, and you didn't pay attention to the relapse sign or the warning signs. Because again, relapse does not happen overnight. Okay, there were warning signs there that no one really paid attention to, or didn't have time to pay attention to, or didn't pay attention to. So now we're in a situation where your loved one is now psychotic, meaning they're out of touch with reality. Now you have to call the police. When you call the police, what you want to do is, number one, do not be really overly excited when you call the police. Because remember, the police don't know your loved one, unless they happen, live down the street or something. But most of the time, the police will not know your loved one. They will be seeing your loved one for the first time. So what you don't want to do is kind of hype it up and kind of make it, run and meet the police and oh my God, he is just off the walls and I don't know what to do and blah, blah, blah. And you just all overly excited and you just going on and on. That automatically is going to put the police on edge. Because remember, they've never met your loved one. If you have to call the police, you want to meet them at the door calmly, right? And explain to them why you called, right? You want to explain to them, hey, this is why I called. Blah, 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 blah. He's not dangerous. He's not taking any medications. But keep in mind, again, when you call the police, you can say all you want that they're not dangerous. You don't know how they're going to respond once they actually see the police, okay? So you want to meet the police calmly and explain to them what's going on. What I usually do, if I meet the police and tell them, hey, this is what's going on, I will walk with the police to the person, and I'll kind of mediate and say, okay, hey, John, this is Officer. Remember, this is Officer Brown. I told you I was going to call the police, so we can kind of get some help for you to kind of get you to the hospital. This is, have that conversation, okay? If you can do that. Sometimes you can't. But again, if it's your loved one, my question is, why is it that you expect the police to do more than you can do, right? Why don't you have a conversation? Why was there nothing done between you and your loved one, right? It's your loved one. So people would say, are you blaming the victim? No, I'm not not victim, but blaming us. What I'm saying is we need to do more. We need to do better. Some of us need to do better, yes. We need to do better. Because if you're calling the police, I had a situation one time where we had to call the police, and the police showed up, and the police who came was and they're called different things in different states, but they're the police officers who's trained to deal with people who are mentally ill, who have a mental illness, okay? So the police officer came, again, we explained to the police officer what was going on with him. Police officer did a great job, as many of them do. They did a great job. But here's the thing. The gentleman wouldn't respond to commands, right? And the command was to take your hands out of your pocket. His grandmother was there with me, and she was, of course, said, no, he's, don't hurt him, he's fine. But again, the police don't know that. And you don't know that either, technically. But the question is, here, he wouldn't respond to command. So again, the police had to restrain him, take him down to the ground, put him down on the ground. And she was like screaming, not screaming loud, but oh, don't do that, this type of thing. He's harmless. Well, when the guy went down to the ground, come to find out, he actually had one of these nails, and it's a name for it, but it's a really, really long nail that he had in his pocket. And I say that to say that there's a lot that goes on with this. There's a lot. It's not as easy as people think when you're dealing with someone who is living with a severe and persistent mental illness, who at that moment is psychotic or is out of touch with reality at that particular moment. It's not always as easy as you think. You may know the person, and because you know the person, then there are certain things I would encourage you to do differently. If you know the person, they're not a danger, this is your loved one, then maybe you can persuade the person and get the person to the emergency room. Maybe you don't need to call the police. Right? But keep in mind that if you call the police, even if the police are trained, that there are certain things that they will have to do to keep themselves safe. So you're on the sideline saying, oh, he's homeless, that may be fine and that sounds good to you, but we don't know how he's going to respond when he or she actually encounters the police or with particular commands. We had another lady, she was an older lady, but was fine. It was not an issue with her. But when the police came, we had to explain to her that the police are going to handcuff you. And people were like, well, this lady's like 80. Why are they handcuffing her? Because, again, yes, she's an older lady. She's calm, very nice, sweet lady. But they're transporting her. Right? You don't know how she's going to respond in the back of the car. Right? Because they have to put her in the back of the car. You don't know how she's going to respond from the office to the car. So there are procedures and things that they have to follow to ensure that everybody is safe. My response to this, again, this is my rant. If you have a problem, you don't like the way things are being done, then you have to ask yourself, why are you even calling the police? Okay? Why are you calling the police? When you call the police, you should not have a reason for calling the police. Right? You should call the police as a last resort. If it's your loved one, because again, there are certain things, you live with this person. So there are certain things that I would have hoped that would have been done prior to that, but it wasn't. Now you're in a situation where you have to call the police. The police come out, like I said, you want to meet them calmly, you want to explain to them, you want to kind of be there during the interaction if you can. If you're a loved one, if the police do take your loved one to the emergency room, you want to follow, you want to go along with them, you want to be there at the emergency room as they're talking to the doctor, so you can explain what happened if possible. So there are a lot of things that you can do. So again, going back to the situation with Jordan Neely, it was so many people knew this guy had a mental illness, and I don't see anywhere where it says that he was connected to a meeting, to a mental health clinic. It talked about how his symptoms may have started when his mother was brutally murdered over 10 years ago. And that kind of probably triggered his illness. Many times a person may have, and we talked about this before, the stress reduction theory, where many times a person has symptoms of mental illness, it takes a stressor to kind of trigger it. So there are a lot of different things that you can take from this. But I think whenever we have a crisis, something happens like that, it's real easy to blame, okay? Ultimately, the person who's at fault for his death is the person who choked him. That's ultimately, right? So I got that, and we're clear about that. But we have to take a look at our responsibility as family members, as loved ones who watch this person with a mental illness struggle every day. 2, the other people who are around him, who see him struggling with mental illness every day and never called or never did anything. The police, okay, who, well, it doesn't say that the police actually, it sounds like they just knew who he was. But the system, because our system is so fragmented, so underfunded, so understaffed, so many things, that it's going to take, that saying, it takes a village to raise a child. It takes a village to kind of manage severe and persistent mental illness. A village of clergy, police, firefighters, first responders, family members, teachers, schools. It takes everybody when we're talking about severe and persistent mental illness, because it's always a fine line that you have to walk between a person being actively psychotic. Well, he's actively psychotic, but is he a danger to him or herself? Because if he's not a danger to him or herself, we don't want to take away the person's rights, right? So that's another thing that keeps people from getting people help. Well, we don't want to take away his rights. If he wants help, he'll ask. Again, a person who's actively psychotic may not know that they need help. Okay, when you see it's 20 degrees below zero and you see people outside poorly dressed and they're just sitting outside, that person is in a sense bleeding out on the street. That person needs help. Okay, you don't have to feel bad about calling, or I don't want to call, I don't want to get them in trouble, I don't want to feel like we're taking away their rights. So you would rather for them to die on the street, because when we're talking about severe and persistent mental illness and a person is actively psychotic, at that moment they are not in touch with reality at that moment. It doesn't mean that they will always be out of touch with reality. That's why treatment, medications, getting support is so important. But if we don't get them treatment, we don't get them support, then they will continue to be psychotic. And with each psychotic episode, their baseline goes lower and lower. So again, we need to not wait until there is a crisis. And the blame here, there are so many people that could have done something differently. There are so many things that could have been done differently before he met that Marine. Who, the gentleman, I don't know if he's retired Marines or whatever, but before he met him, before he lost his life on the subway. Because right now, a lot of people are stressed out. All of us many people are stressed out, right? It doesn't take much, right? So when you have someone that's acting out erratic on the train, everybody who knows him may know that, oh, he just has a mental illness. This is the way he is. But maybe the Marine may have seen him for the first time, didn't know who he was. Maybe he thought he was going to hurt him, or that his life was in danger. Who knows what the Marine was going through at that moment? So we never know, right? And again, I'm not minimizing, because he should not have lost his life. But what I'm saying is, for those of you who are outraged now, it should not have taken this for you to get outraged. You should have already been outraged. You should have been outraged about the fact that we have so many people out on the streets who are not getting help. You should be talking to your local officials. You should have already been doing that about, hey, we need to get help. You should be outraged about the fact that we have so few psychiatric beds that even if we do get the person to the hospital, we can't keep them because there's no place to keep them, right? You should have been outraged about that. You should be outraged about the fact that we have so many people that are in jail as opposed to psychiatric facilities because we don't have enough psychiatric facilities. You don't need to be outraged about the fact that jails are not treating people. Well, you can be outraged about that too. But keep in mind, jails were not designed to be mental health clinics. The police were not designed to be psychiatrists or to be mental health counselors. That was not their job. They're doing it because there's no one else to do it. The jails are housing people with a mental illness because there are no beds. There is no one else to do it. So again, it's real easy to blame the jail system. It's real easy to blame the police. But we have to look at ourselves. We're not doing enough, right? Again, as I said before, anytime we have to call the police, anytime a person has to go to jail instead of going to a bed, that's not the jail's problem. That's not fault or the police fault. It is our fault. It is a treatment failure. Where is the mental health team? Where is the crisis team? The mental health crisis team? Where are the mental health supports? Right? That should be out on the streets. That should be working with individuals who are severe and mentally ill. Every city, every country, every county, we know who they are because they gravitate. They hang around the same places. They're under the same. They sleep the same places. They sleep under the same bridges. We see them on the same buses. We see them on the same train. We know who they are, right? So again, it's real easy to want to blame the mayor, to blame the governor, everybody wants to blame everybody else. But what are we doing? Okay, what are you doing to get your loved one help? What are we doing? Are we going to our mayor, not to our mayor, to our city council? Everybody wants to pass the buck. See, and then when, I think about in New York, for example, I know the mayor wanted to pass some different types of, I guess, laws or rules he wanted to put in place that would make it easier to get people off of the streets. And there was so much pushback from quote-unquote activists that I don't think that they ever did anything. So I'm wondering now, with Jordan Neely, will that revive the conversation? Because unfortunately, it takes things like that. Because, we always say, everybody wants to blame everybody, but the bottom line is, it's all of us. It takes a village. There's more that we all can do. As I said before, it's not up to the police. It's not their job only. Before that person gets to a police officer, they could have gotten help 4 or 5 times before they got to the police. Before that person got to jail, they could have gotten help 4 or 5 other times before they got to jail. What I'm saying is, there were other people that could have assisted and could have helped them before they got to jail, right? While the police is dragging them off to jail, they're passing by several mental health clinics. They're passing by several therapists' offices. They're passing by counselors. It's real easy. And again, this is my rant, so people may not like this, but it's real easy to focus on quote-unquote the worried well. It's real easy to focus on people who that can pay. To focus on people who that are going to get better in 6 weeks, 6 or 8 weeks. To focus on people who are working, focus on people who are educated, who are smart. And I'm not taking away from that. But let us not forget that there are some people who are living with severe mental illness, who are psychotic, meaning they are out of touch with reality. Because having a severe and persistent mental illness doesn't mean that you'll always be out of touch with reality or psychotic. There are a lot of people who are living with a severe and persistent mental illness. See, that's the goal. We want to get people to understand that you're diagnosed with a severe and persistent mental illness, but you can learn to live with it, because it's just like any other illness that can be managed. There are people who are living with a severe and persistent mental illness who are married, who are doctors, who are going to school, who have children, who are living lives just like everybody else is, okay? So, but that's because they got treatment. Treatment works for severe and persistent mental illness, and they're managing their treatment. What we're saying is that there are people like Jordan Neely who are diagnosed with a mental illness and who are not managing their illness well, who are actively psychotic because they're not getting the help that they need. And I'm saying for these group of people, we need to do better. Who is the we? All of us. Okay? Jordan Neely had a family, because it said so here. He had a family. A lot of these people with severe and persistent mental illness, who are psychotic, who are out on the street, who you see, they have families. Okay? What happened to the family? Why are they not connected with a mental health team? Almost every city has a mental health team, a crisis team that's supposed to be out in the streets, right? Supposed to be out in the streets connecting with people. There is help out there. We have to get them help. You cannot let fear stop you. You cannot let, I don't want to take away their rights. Here's the thing. If they were, as I said before, if they were bleeding on the street, it wouldn't be an option. I would rather have a person who is actively psychotic to be taken against their will, okay, to the emergency room or to a doctor's office where they can be evaluated, and the doctor can talk with them and maybe get them some type of help. I would rather for that to happen as opposed for them to be choked to death on a subway train. I would rather that, okay? Because what happens is, once you get a person to the emergency room, and I talked about this a couple of times before, and we have something on our website as well, but when you take a person to the emergency room, it doesn't necessarily mean that they're going to be admitted. What it means is that they will be evaluated by a mental health professional. And that could be a psychiatrist or it could be a clinical social worker. Once they're evaluated by that team, that person, that mental health team may decide that, hey, that person doesn't need to be admitted, but they agree to take some medications. They agree to connect with a community mental health provider the next day, right? Or if they are admitted, they'll get admitted, they'll get a thorough workup, they'll get medication, they'll be connected. The whole idea is if the person can get connected to an emergency room, for example, from the emergency room, they can get connected to other services, to other services. But as long as you are so afraid, or you don't do anything, you walk by them, you ignore them, you think it's the police duty only to take care of them, then nothing gets done and nothing happens. So again, this was my rant. Using Jordan Neely, because I know a lot of people are talking about what can be done, and my question is, what are you doing? That's my question. What are you going to do about it? Don't tell me about what the police are doing or about the jails, the problem at the jails, because there's so many people in jail. We already know that. We already know that the jails are the biggest, that there are more people in jail than there are in mental health clinics, right? Give or take, right? We already know that. We already know that there are not enough beds. We already know that. Okay? What are you doing? We already know that the police need to be better trained. You need to be better trained, all right? Because if you are better trained, then your loved one wouldn't get to the police. See, we're trying to avoid interaction with the police. What are you doing? Because again, it's not their job. They do it because they have to. The jails arrest people and put them in jail, and they do the best they can with people who have a mental illness because they have no place to put them. What are you doing? You need to be asking your elected officials, whether it's your council members, your aldermen, your whatever it is. Okay, we need to do something in our community. What can we do in our community to help our brothers and sisters who are living with a severe and persistent mental illness? What can we do? Not just talking about mental illness, okay? Not just talking about, passing out little bags and giving balloons and doing little speeches. That's wonderful. But we need to go beyond that, because those balloons, the little speeches and passing out bags, that's not helping the people the people with the severe mental illness. What are we doing for them? It's great we're helping some people with those efforts, but we need to expand our efforts to help people who need it the most. Why don't we help people who need it the most? I'm glad you asked. I can tell you why. Because it's difficult, it's challenging, it's not easy, and that's why people shy away from it. I can tell you, anytime, we get a little money to help people. Again, I told you this is my rant. This is a rant from a clinical social worker, okay? So when money does come in to help people with severe mental illness, the money somehow gets taken away and put into other areas. So we don't never really get the money fully that we need. So again, advocate, advocate, advocate. Use this as an opportunity to advocate for better support for individuals with severe mental illness or severe and persistent mental illness, and advocate for you yourself, people who are listening to me, that you will get the help, not just the police, that you will get trained so you would know what to do. It's real easy to pass the buck, and we don't want to do that. So again, it's getting better all the time. Mental health outreach, providing information and support while encouraging hope and faith. You can find out more about us by logging on to our website at igbattmho.org. Have a great day.